Mary, you manage the activities of more than 300 nurses and support staff in the maternal child health, critical care, and perioperative services. What are the normal dialogue or problems or things that go on with managing a staff of that large a number?
Sometimes I wonder. I think that the main thing, my main focus many times with dealing with multiple departments is collaboration, both within nursing and outside of nursing as well, to make sure that we all keep the patient as the focus. We know that patients come to hospitals because they need nurses. They need nursing care 24 hours a day, 7 days a week. Otherwise, they could be treated at home or in their physician's office. And so the importance of nursing and the importance of the patient is what we need to keep focused upon. Sometimes it's hard to maintain that focus when faced with all of the other fires that you put out through the day. But the quality of the care that we provide as nurses, the clinical expertise of our staff, assuring that we're working towards the standards that are current, both from the skill piece as well as the caring and compassion piece, and making sure that we help others that work in the hospital to understand that their role is vital to the care of the patient.
Mary, is there a shortage of nurses not only here or throughout, or is that something we read about, or is that a real thing?
No, it is a real thing. It's a real thing, and it's complicated by the fact also that there's a shortage of faculty to train and educate new nurses. So that there are lots of people who are applying to schools of nursing and universities throughout the United States, but master's prepared faculty are hard to come by. In this area of the United States, it doesn't seem like it's a big deal because there are a lot of master's prepared people, but when you talk about rural communities and other communities throughout the United States, it's difficult to find a large number of master's prepared people to teach in schools.
It must be difficult to get nurses who are trained in an NYU or here in Elizabeth General when that program is going on to go to some small town in Pennsylvania to be a nurse. I mean, why would they do that, right?
Well, sometimes,
and then they don't have a school in a small town in Pennsylvania to learn to begin with.
Right, right. And so everyone's competing for the same human resource. And many times hospitals compete through money, trying to give sign-on bonuses and who can give the biggest rate of pay for new graduates, but it becomes difficult in order to be able to get quality students and quality new graduates. We're lucky in terms of having our own School of Nursing that we've done a lot of efforts in the last year since the merger to really increase the number of students that we recruit to work in our organization.
How many stay? Is there a ratio to that? Or?
There's not exactly a ratio, but we graduate about 60 students a year, and we probably keep, I'd say 20 to 30% of those. We've just hired, Mary, 15 or 16 graduates from the January class, and that's really given us an enormous strength because, not just because I say it, but they're fabulous nurses. Mary's one of them. And, so we're very, very fortunate to have that program, and it's really helped us to keep abreast of filling the vacancies.
Now, Mary and Sharon, do you do any more clinical work? Do you work with patients, or is your job basically now administrative?
No, my job is administrative.
And Sharon?
Well, I wear many hats.
Oh,
I manage the program on day-to-day. I help with the developing of it, the marketing of it, but I do consult and see patients on a daily basis as well. I also help educate our staff. So I wear many, many hats at Trinitas.
But you start off dealing with patients, right? So the more knowledge you get and the more you move into administration, that's another part of the system losing quality people like yourselves, correct?
I think so. I think you can't do Mary's job or Sharon's job unless you've got a very strong clinical background. So it's important to us. Mary started to talk about this, but when we bring new graduates in, we have a very strong program for them to orient them, and it usually takes them anywhere from 6 to 12 months to really be comfortable and to feel confident and competent. So we've put a lot of energy into developing those programs at Trinitas for new nurses.
And there's a couple of ways that we develop that relationship too, and that there are many of us who are administrative and managerial and clinical specialists who teach in the School of Nursing.
Yes.
So that we develop a relationship with the students while they're still in school, And then also we have a nursing externship program that we run during summer and winter break, so that the students actually come and work for us, a small group of students, and get additional education from faculty members so that they get to know us, trust us, see how we are, what kind of care we give, so that that strong relationship is there, so that when they graduate, they do want to come and work for us.
Mary, we'll start with you on some of the hallmarks and services and care that the average person can find in a pediatrics department.
Sure. Trinitas has been well committed to having a pediatric service in the city of Elizabeth through the merger and continuing. And we have an array of pediatric services, both outpatient as well as inpatient. We actually start in the newborn period when we talk about the Pediatric Health Center, as well as on the inpatient side in the newborn period, the presence of a neonatologist who is a specialist in the care of sick newborns, as well as having a pediatrician in the hospital 24 hours a day, 7 days a week, so that when moms deliver, if there's any problems with their newborns, there is a pediatrician and or a neonatologist that's there in the hospital to help to take care of them. After they go home, we also have a pediatric health center, which provides for both well visits, immunizations, and also sick child care. We have a federally funded grant called the WIC program, Women, Infants, and Children, that provides nutrition for pregnant women, for breastfeeding moms, and also for newborns and for young children, school-age children, to make sure that they have appropriate nutrition available to them to remain healthy during the pregnancy, to have a healthy newborn, as well as to grow developmentally and to receive adequate nutrition throughout their young years. We also have on the inpatient side an intermediate care nursery, which is again for sick newborns, and we have the opportunity to have some premature newborns stay with us, also newborns that have infections require antibiotic therapy, so that they're able to be in their community close to their moms and not physically separated from one another even though they're sick. We also have a pediatric inpatient unit, which is an 11-bedded unit wherein we provide general pediatric care for the children of our community, and also again 24-hour pediatrician coverage taking care of those children as well. The physicians that are in our pediatric health center also will admit children into that unit as well, so that there's continuity of care from the ambulatory side to the inpatient side, so that we're able to provide services in a general pediatric sense, but also we have a strong relationship with Newark Beth Israel Medical Center in Newark, wherein they assist us in terms of stabilization of very sick newborns, also transport for mothers and for newborns, and also for children who require services that we don't have available in our community. And we work very closely with them.